Now, young people in their 20s to around the late 30s are presenting with moderate to severe disease. Some are needing intensive care. And this is according to the Chris Hani Baragwanath Hospital, which says it's seeing a marked change in the demographic profile of patients with COVID-19. Let's get an update now on the situation at the hospital. And for this conversation, we're joined by Professor Rudo Mathivha, the head of intensive care at Chris Hani Baragwanath Hospital. A very good afternoon to you, Professor. At what point did you start actually seeing a rise in the number of ICU hospitalizations, specifically among this age group that we're focusing on now?
Well, we started seeing an increased demand for critical care beds last week. Before that, we had seen a rise in COVID-positive patients presenting to the hospital, and it was mainly the younger age groups, mid-20s to mid-30s. And then we also noticed a disturbing trend in the pediatric department, where we started seeing toddlers under 5 and then the older kids between 6, 7, 8, 11-year-olds, 12-year-olds presenting with symptomatic COVID, requiring admission to be treated. Our ICU requests have continued to go up this week, and that has also included patients from the obstetrics department. We have also seen a rise in obstetrics patients presenting to the hospital. As we speak today, we've got 37 obstetrics patients that are admitted to Chris Hani Baragwanath Hospital. 22 of them are quite symptomatic, and the others are just having mild symptoms. And they, unfortunately, were all not vaccinated. Mid-20s to late 30s and maybe edging on to the 40s that we're seeing are either not vaccinated, and then a small percentage did not complete their vaccination schedule. So if they were doing the Pfizer schedule, they had their first shot and didn't go back for their second shot.
The numbers that we heard from the Gauteng Coronavirus Council this morning were people under 40 are continuing to be the ones that are being mostly hospitalized. And even within the ICU unit, you are telling us that you have actually seen a marked increase. Comparing those who actually were vaccinated to those who were not vaccinated at all, what percentage would you say actually were vaccinated, but then who went on to contract COVID-19 and then find themselves in ICU?
At the moment in our ICU, we do not have anybody that wasn't vaccinated. What we have observed is that the vaccinated people, and I'm using an example of our staff members who are also contracting COVID, who were vaccinated, they're getting mild disease. They, however, still have to go home and take supportive therapy, but they're not getting severe disease at all. The ones that are in our intensive care unit are unvaccinated. The sad thing is right now we've got a 17-year-old young man who is mechanically ventilated with COVID pneumonia. We are awaiting a 15-year-old child who is also having respiratory problems, who is COVID positive. So these are the age groups that we're talking about. These are the age groups that we did not notice in the previous waves.
Yeah.
It is right that the majority of the population out there may be contracting mild disease, but those that are getting through to our tertiary academic hospital are presenting with severe disease and often critical illness.
Now, Professor, Professor, I wonder, and you made the statement that what we're seeing now is a different trend to what we were experiencing in the first 3 waves, and that younger people are being infected. What do you believe is behind this? What would you attribute this change to?
So with the kids, it's totally not making sense to me, because young kids, toddlers, often just shrug off viral infections. Now, this is a change, because in the past, they used to get COVID infection, but handle it very well. And we hardly ever admitted them. We did admit smaller infants, but they were not that badly ill. So this is a worry now, because they're no longer handling this virus well. Is it because it's a new variant? Number one. Number two, the older kids, you know, may I say the young people in our population, the university-going students, the high school students, is it because they were not so keen on being vaccinated and therefore they're not protected? The older people that we prioritized when we started our vaccination program, have we protected those? And is that why we're not seeing them presenting with severe disease? Are they just getting mild disease that is burning itself at home? But that doesn't completely explain everything. There is something else that is playing in this arena. And in my mind, this is in my mind, and I'm not saying it's the gospel truth, the only way I can explain it is we have a new variant. And why I say this is because in the third wave, when we thought we handled the first wave and the second wave pretty good, and we were going to walk over the third wave, something similar happened. The Delta wave hit, and we were chasing our tails as though we didn't know anything about COVID. And this is throwing a spanner into the works. It may be this new variant. It is early days. We don't know what it is capable of. Is it only going to hit the unvaccinated people? But it is infecting vaccinated people, and they may be handling it better because they're protected by the vaccine.
Prof,
Yes.
Professor, in the briefing, it was confirmed that Omicron is driving the number of infections in the Gauteng area. Now, post the discovery of the presence of Omicron, with specifically the pediatrics and those who are under the age of 5 and the young people who, you know, we're still trying to figure out exactly what is behind them contracting the virus, has it been ascertained which strain or which variant of COVID-19 they actually do have? Has the analysis of the virus been broken down to that extent, to the variant type?
You see, the analysis, the genotyping of the virus happens later, not acutely as I'm seeing the patient. When I do the swab and I get a positive result, I can just tell the patient you are PCR positive for COVID, but I cannot tell you which variant you have. That sample has to be taken to the virologist where they do genotyping, and then they can tell us which variant it is. This is how we get the information, and that information lags behind the patient presenting in the clinical environment. But as clinicians, as we get that information that lags behind, we then try and match it with the symptomatology that we're seeing. And eventually we're going to be able to say, okay, this kind of presentation we saw in a patient that turned out to have Omicron infection. And it may take us a few weeks, but we will be able to say, okay, here we're dealing with possibly Omicron, not with 100%. So, yes, Omicron seems to be the big dude at the moment in Gauteng, and we can assume that that's who we're dealing with. And we just need to try and interrupt its infection strategy. Get out and get vaccinated, young men and young women. Wear your masks, sanitize your hands, and try and socially distance. No raves this year. There are going to be many more years that you can go to your raves. And let's try and avoid large gatherings, large funerals, large weddings, because those are super spreader events. We can do this as South Africans. We can flatten the curve of this Omicron. And it's in our hands. We have vaccines. Let's go vaccinate. The anti-vaccine lobby, just kind of take a back seat for a little while until we get on top of this. Then you can go on and blow your vuvuzelas again. But right now, we need to get on top of this. We need to protect South Africa. We need to protect the children. At the moment, we don't even know what doses of vaccine to give the children because the clinical trials on vaccines were not done on children. We still have to figure out how we start vaccinating those young children to protect them against these mutating variants.
It certainly is a very high-pressure situation that you find yourself in as medics. So how exactly are you dealing then with the vaccination of children, specifically because it hasn't yet been tested? What type of treatment are you giving them in ICU?
Well, there's nothing to kill the virus. So we look at the deranged physiology of the child and we try and correct that. So we call it supportive therapy. There are medications that can help you to try and support, correct the physiology. Corticosteroids, immunoglobulins. If there's respiratory failure, you can give supplemental oxygen or you can intubate and mechanically ventilate. So you just, as much as you can, try and normalize that physiology until the body takes care of the virus itself. The body is a sophisticated organ. It's got an immune system that will eventually wake up and fight that virus. In some patients, obviously, this doesn't happen and we lose those patients. As far as us, as healthcare workers, it's rough on our mental health. We don't even get time to debrief, but we just have to get on with the job because patients are sick and they need our help. Colleagues are sick. That leaves us short-staffed. So it's not a good place to be right now. But we cannot afford to panic as a country or as a province. We need to fast bait and work and try and beat this thing.
Professor, there are some studies and reports that say vaccinations for children under the age of 5 may be available by next year. As you said, that the studies are still ongoing. Do you believe that all age groups ought to be vaccinated? And at what point do you believe that that vaccination needs to start or happen?
I'm a mother and I'm a grandmother, and the sentimental, emotional me says, let's start giving them the shots now. Let's extrapolate the dosage right now and give them, vaccinate them. There are studies that are being done on younger kids, but not on the very young. And maybe we can take a cue as to what has been observed there, even if those studies are not complete. We cannot wait until we're knee-deep in paradise to say, oh, well, maybe we should reach for that vial and start vaccinating the kids. This is me. It may not be a rational approach. I feel we need to protect them now before things go awry.
Professor,
but my scientific mind says, wait, let the scientific data come in.
And on that point, the scientific data is very important and really should be the premise upon which we're going to be making whatever decisions. I understand from what you've been saying that the majority of cases and reactions to vaccinations that you've seen have been positive and have actually assisted the patients. But have you also come across those perhaps who've reacted negatively to vaccination?
Personally, no. The only reactions that I would say were adverse were very limited. You know, a headache, a fever for 24 hours, you take a Panado and you're good to go. But we have had stories of people that have had anaphylactic reactions, but they were very, very, very few. You might have heard, you know, internationally about the thrombotic episodes that happened with some types of the vaccines, but it was like very few people per million doses. So you need to balance the benefits against the few that got affected. So, and look out for the good of society.
Professor Rudo Mathivha, thank you very much for your insight regarding the situation and the new wave and the new trend that we're seeing now. As the professor was saying, younger people are finding themselves in intensive care, sometimes even, you know, in the pediatrics, you know, section, in children under the age of 5 having COVID-19 symptoms and sometimes even being oxygenated, she says. She is the head of the intensive care at the Chris Hani Baragwanath Hospital. Thank you very much, Professor Rudo Mathivha, for your time and your insight today.